Happy birthday to you.
Yes.
Happy birthday to you. Happy birthday.
Yes. I love it. Thank you. Thank you.
You're welcome.
I love it. I love it. Like I said, I got me being the extra person that I am, and you should know by now, I am very extra.
Yeah.
I actually have two parties that I'm doing today. So
Okay. Good.
I'm doing a brunch, and then we're doing. Okay, I had to tell you what the other party is out live, but we doing
Okay.
old school Alabama party. So
Good. Good for you.
good, good, good. Okay, well, welcome everybody. Let me stop the banner. Uh, okay, welcome to our. Wait a minute, you're not muted on Streamyard
Oh, sure. Okay.
because I'm like I hear the echo. Okay, we good. Yeah, we good. We good. We good. Okay. Well, welcome everybody to our Saturday morning tea, where we discuss health information, news, education, and certification tips, and all the burning questions that you may have. Anything that comes up in current event. We just discussed it all. Basically, we just discussed it all. I'm Clarice Warner. I'm the girl with the pearls. I am the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And before I introduce my co host, Mr. Jesse, today's episode is sponsored by the Professional Reimbursement Network's free email course on the 5 steps to become a certified marketable medical coder. So check this out. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Yes. So if you are interested in the 5 steps to become a certified marketable medical coder, if you are on Clubhouse, and welcome to our people in Clubhouse, Asha, Sandra, Latoya, and Kathy. Welcome. Um, Feel free to click the link at the top of the page. If you are joining via YouTube and Facebook, check the video description for the link. Joining me today is my illustrious co-host, Mr. Jesse, the coding nurse registered registered trademark, the coding nurse. All right. Sir, introduce yourself and tell the folks all about you. Thank you. Cool. Look at you. Look at you. Doing all the things. Doing all the things. All of the things. Don't sleep. If you are a nurse and you are involved in or hearing everything that's going on in your nursing profession and you're looking for an exit strategy, I totally recommend that you check out the coding nurse. Look at you with your little R on your thing. Wait a minute, I just saw that. Look at God. Look. I love it. Okay. I'm sorry, y'all get caught up. But I totally recommend Mr. Jesse and the Coding Nurse program. Let him help you transition from the bedside to the wonderful world of health information. Now, don't come over here thinking y'all gonna take over. Let me just preface that right now. Don't come over here with that mindset. But we do welcome you. We welcome all. We are a welcoming, loving bunch of folks, and um, there's space for all. Your gifts will make room for you. Amen. Amen. Okay. So today I'm all hyped up because it's my birthday. It's my birthday. Woo! And so celebrations all around. I'm excited. I'm happy. I'm exhausted because it's been a long week. You all know that I'm well involved with my organizations. But I'm also a board member for our Citizens Complaint Authority here in Cincinnati, where we just celebrated our 20th year of the collaborative agreement that we have with our local police department. And it's a wonderful arrangement. It started out a little contentious, but it's a wonderful arrangement where we all kind of sit down and just make sure that folks are following the policies that they have set forth. Um, and so we collaborate, we talk about, we discuss. And part of my board orientation and training was I had to do some ride alongs, I had to sit at the police academy, and they did everything in 1 week. So, so that on top of what I'm supposed to do regularly for my business has been a lot. But by the grace of God, everything got completed, and we are here. And trust and believe we're gonna celebrate it all today. All righty. So, with that being said, but not only is it a celebration for me, today starts the week long celebration that we have for health information professionals. So, April 18th through the 22nd is Health Information Professionals Week. What's up? Yes. So, not only will we be celebrating me today, but we all will be celebrating each other all next week. So, make sure that you are celebrating all achievements, accomplishments, and everything that has gone down. It's been a lot this year, the last 2 years. It's been a whole lot. And we need to take the time to celebrate. I want to talk a little bit about the themes that they got going on here for Health Information Professionals Week. Really the focus is health information is human information. Yes. And health information represents many things to different people, but it means something to everyone. And your health information is your story. It's sensitive, nuanced, and complex. But above all, health information is human information. And we, as health information professionals, we basically see the person that's connected to all of that data. So we're working, whether we are doing release of information work, whether we're doing auditing, whether we're coding, whether we're doing compliance, whether we're doing CDI, data analysis, all the many hats that we as health information professionals can and do wear. We are making sure that we're doing what's necessary and what's needed for that person that's connected to that data. So again, we work tirelessly to ensure that your information, our information stays human, because when information stays human, it stays relevant. And so this perspective is critical to the success of all modern health organizations. So don't forget to uh, make sure that your organization, or you, even if your organization don't, make sure you come in there celebrating Health Information Professionals Week all next week. Do something extra. Be extra. Be extra. Okay. Let's see. They're saying your sound is low, so let me see if it's on my end. Let me turn it on. Okay. Okay.
Before I was on speaker, but I put in my earpiece, so maybe that's
Okay. Is that better? Evolving 365? Let me know. Let me know. Let me know. And everybody in the room, welcome. I'm inviting you to speak. Feel free to come up to the stage, join in on the conversation. Mr. Jesse, I will ask you if you had, I didn't have anything formal, if you will. Only thing I wanted to talk about was Health Information Professional Week and, of course, my birthday. But I do have a couple of quotes, and I do have some encouragement that I do want to share um, with folks at some point. Welcome, Sandra. She came up to the stage. I'm trying to read what your thing says. Oh. Hey, Asha, you're muted, Sandra, if you were talking. There you
I
go.
wasn't talking. I didn't hear when you said that I could talk. I'm hearing the echo, though. Are you hearing the echo when you're in? I'm not.
I'm not either.
Okay, good morning, everyone. My name is Sandra L. Washington. I am the managing partner of MediHealth LLC,
Mhm.
which is a patient advocacy, a board certified patient advocacy company.
Hmm.
I came to the stage this morning, first of all, to say happy birthday to you, Clarice, even though I don't know you.
Well,
You
thank
sound
you.
like a beautiful person.
Thank
So
you.
happy birthday to you. May you continue to enjoy a blessed day.
Thank you.
And also to let everyone know that we will be, when I say we, MediHealth will be hosting a patient symposium next week. It's all about listening, sharing, and learning.
Okay.
So if anyone is interested in coming out to support, please do so. It will be on Clubhouse
Okay.
and it will be from 12 to 2 on the 23rd of April. So thank you so much for allowing me to come up and speak. We
You're
are all
welcome.
doing the same thing, which is pushing and encouraging our patients to ensure that they get the best health care possible. So
Well,
thank you so much for allowing me to come up on stage.
you're welcome. You're welcome, and good luck with your activities in your event on the 23rd. And I'll be actually looking out for it on Clubhouse. So that's what's up. Hey, Asha, how are you? Or Jesse, you want to say? I see you.
No, I
Okay.
Good morning. Thank you for the platform that listening to this whole platform. The Clubhouse is very useful, but I'm learning one how to use
Yay!
it.
That's
But
part of me allowing people to come up to the stage so they can see what it looks like on the other side. So even we're learning, we're all learning here, and so it's like, why not come and see what it looks like on the side if you've never been on that other side? Come on.
right, and being in this field with information, hospital administration, science, and medical coding, it well, I'm coming from New York.
Okay.
So it seems to me to be a very limited space of getting of network.
Hmm.
So when I get on Clubhouse and I hear you guys talking, I get excited. Because hey, you look like me to everybody here that I've met doesn't.
Yeah. Okay. Okay. Come on.
They don't look like me, and they're not friendly about what they have to share. And then when you dig a little bit deeper, you find out that they may not have the education that amount to be part of the problem.
Oh,
Um,
okay. Spill that
come
tea,
on
girl.
now.
Spill that tea.
Come on now.
so I'm real mad because I look like I look, and I want to be educated, and I want to have my certification, and I'm eager to learn. And this is my second career.
Okay.
So I'm excited. You guys get me really, really hyped up because you also have to work in the other businesses, and that's what I learned about the industry. That there's so much out there.
That's
So
right.
thank you so much for the platform. Thank you so much for sharing and being generous.
Yeah.
And thank you so much for the opportunity to speak.
Definitely. Thank you. Thank
Oh
you.
my God.
I
Can
know.
I jump in?
Jump on in because I know you coming. I felt it in my spirit already. Go ahead.
Listen, I said you have made my weekend.
Yes.
So, as Yana said, I am confused
Yes.
because
You gonna make me shout in
I
here.
said you hit the nail on the head because what you are talking about, and Clarice will tell you, my word that I use to describe the HIM industry is gatekeeping. There is so much gatekeeping going on that it is ridiculous, and it is always by mostly by people who don't look like them. And they're not going to ever help you because they're not ever going to help you get to their level. And you're already, the truth be told, you're already beyond their level.
Mm.
Because what I did was, like I tell everybody, I did not set out to have as many different ways I did. I did it all of myself, trying to be as valuable as possible, trying to be as marketable as possible. So what it ended up doing was it ended up working against me. And then when I started reading journals and reading articles and reading, and then seeing where I was applying, who I was interviewing with, and I was looking at their education, and it's not matching up on my resume. How do these people have this position, and then when you look behind the curtain, they don't know as much as they claim to know. They become a problem. So what I would encourage you to do, and everybody else, this is why Clarice and I are here, and like you said, the key point is we have LLCs because there is a way for you to market yourself to make money for yourself. Don't ever depend on a job, especially in HIM, to pay your bills because you don't have to.
Amen. 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 And let me leave you with this. This is what I guess this will be my first quote for the day. Y'all know I do the motivating Monday message. And even though it's Saturday, I feel quotes in my spirit. I've felt them all morning. First quote: set the standard, set your standards, and set your standards high. Go where there is no path, and you leave the trail. Okay. Okay. Is that what we doing? Yes.
That's right.
That's what we're doing. That's what we're doing. So when we look back, we see him coming, and come on, we'll grab you. I feel a Harriet Tubman in my spirit. We'll grab you and pull you up, but come on. But you keep going. You ain't got to follow in somebody else's foot. What I've learned, even in what COVID has taught me, is that it's because every time I was coming on Clubhouse, I was learning something new. Like, are you kidding me? They're doing this. They're doing what? They're doing who? Wait a minute. Hold up. That you know nothing, your imagination, whatever it is that you can imagine, can be done. Even in this industry, there's so much going on that isn't even invented yet. I tell people all the time, stop asking these kids what you want to be when you grow up. Stop asking them that. Show them some options that may be available today, but you can't ask them what they want to be when they grow up, because it may not even be here yet. If they may be the one inventing what it is that they want to be when they grow up. Hell, I'm turning 53 years old today, and I don't even know what I want to be when I grow up. I'm still inventing it. So come on, y'all. Come on, y'all. Okay, let me get it. Yes. Yes. I appreciate that. All right. So yes, Mr. Jesse. So I don't know if you had anything formally. We try to get together, we collaborate through the week, and we try to have some formal dialogue and discussion for you. But I feel like we are already on the roll right now.
We are. And honestly, it was, in terms of things talk, but it was a very light week. It wasn't anything maybe going on. For a couple of weeks, it was hot and heavy. It was
Hot.
A lot of stuff going on.
Hot.
But it seems to have tapered down for the moment. So I didn't really have it.
Okay.
But
Yeah.
like you said, we already have it. We already have a thing.
We look. Look. Be great. Do great. Believe bigger. Dream bigger. Dream bigger, y'all. It's so much out here. It's so much that you can do. Even as you're going through, even if you're new to the field and you're going through, classes or courses, and or even thinking about, what, this is something I'm interested in, and you're checking out and you're doing your research. And always do your research. Oh my God, please do your research on folks. Please. Please and please. And I always call it doing your due diligence. Not only do companies do due diligence before they acquire another company. So before you put some money down on the table for anything, do some due diligence. Talk to people, call them, ask them questions. If the questions don't sound like what it is that you're trying to do, respectfully pull out, walk away, and it's okay. Folks understand. It is all right. But yes, and I encourage folks not only to get your certifications. Certifications provide you that entry level entrance into the field. Certifications allow them to at least pull you from the general pool to the next pool of folks, and so on and so forth, through that interview and getting the position process. Certification opens all kinds of doors, but then don't stop with just your certification. Don't stop. There are multiple certifications you can get. And if you need to get a degree, do that as well. Come degree up. Degree up. I was sitting here thinking about, a lot of my friends are in I'm sorry, my my workspace and my studio space is, I'm looking at the window. FedEx person just pulled up. There's some flowers that are being delivered to my door. And I can't get to them, but I'll get to them later. But anyway, and I think I know who they come from. I think they come from my baby in Texas. But anyway, what was I saying? Degree up. So if you are, I know what I was saying. So I'm sitting here, I'm thinking about the different people that I know. And believe it or not, I'm surrounded by people from all walks of life. I come from very, very humble beginnings. Very humble beginnings. I'm a hood girl, for real. Don't, a cultured hood girl, but I'm a hood girl. So, and most of the statistics you could check off. I grew up in a low socioeconomic background. Check it off. I grew up in a single parent household. Check it off. I was a teen mom. Check it off. I mean, you name it, I've done it. I've been there. So, primarily the biggest reason for me even starting my company and doing what I do was to show other folks who may be in that particular path coming through that way that there is something else. I've always been an avid reader. I read a lot. And as a child, that would be my escape from my surroundings, because you can read about something clear on the other side of the world, even though you're sitting where you are, and get the information, education, and the culture just from that. And so I've always done that, and that inspired me and pushed me to say, you know what, I don't have to be right here, and I wouldn't. And it's funny because even in my city, people will talk about, well, there's nothing to do. There's nothing to do. I'm like, no, you're doing the same thing every day, week in, week out. There's so much other things to do if you expand your mind, if you open your mind to all the other and yeah, sometimes you may walk through doors and folks don't look like you, but your money is green and their money is green, and the people who own it want your green money. So go on in there and do what you do and experience something different. And you may not like it, and that's fine, but you still have the experience, or you've created an opportunity where you can go in and say, you know what, I've been there and it wasn't for me, but it was this or that or the other. And you just keep on building on that. But I was sitting here and I was thinking about the different people that are surrounding me. And I know, with degrees, there are several studies about the percentages of people who have bachelor's degrees and master's degrees. And I'm sitting here and PhDs or doctorate level, terminal degrees. And I know, I think 10 women that look like me that have their doctorate degree. And I'm like, y'all unicorns, and we all unicorns in the same group. I mean, literally, and I always kid and joke about Kevin Bacon and the 7 degrees of separation. I'm like, we all got 7 degrees of separation from somebody that even if we don't necessarily know them, we have access to them. You got access to the coding nurse, you got access to me, to reach out and say, you know what, I have a question. Should I do this? Should I do that? I have a question. I'm in the middle of whatever, and what they talking about over here? You have this network of, and I like to call it a family. This family here, where we're here to try to help you get to wherever it is that you're trying to get. I'm just feeling the love today. Feeling the love, and don't take any of this for granted. I truly believe that God places us where we need to be placed for a reason that is even beyond us. I started out here on Clubhouse just playing around. Somebody invited me and I was like, okay. And I went out here and I said, okay. And I'm listening, I'm watching, and I'm looking. I'm like, okay, I can do this. And then, woo, I opened up a Clubhouse room, and then, woo, I ran into Mr. Jesse, and here we are all day, every day. So this has just been, a godsend for me. People be like, well, what are you doing on Saturday morning? I'm up and I'm talking to folks, and and they're like, every Saturday. Now there may be some breaks when I take vacation, but every Saturday I'm up, I'm talking. And even if I can't be here, I'm gonna show Mr. Jesse this, and he gonna open this up too. I'll just join as a spectator because I want folks to understand that even in your wherever it is that you're working, even if you're working in a particular facility, folks gonna try to silence you. Folks may try to muffle you out and cover you. And I want to show you, you can come on right on around that. Do you know how many people have Facebook accounts, YouTube accounts, on Clubhouse in the world? You don't have to let somebody else dictate who knows you or who doesn't know you, and what gifts you bring to the table and what knowledge base you have. See, I'm about to hold. Let me breathe. Do you know that? I mean, really, don't let anybody limit you. No limits. Let them use you. There is no now you already know they must say all day in every pulpit across America, especially in the black church. Let them use you. There are no limits, and don't let anybody limit you, and don't you limit yourself. Okay,
Right?
I'll
That's
breathe
the
in.
most important thing. Limit yourself because we let other people dictate our values instead of you dictating your own values.
Come on,
So like you say, you setting your own standard. You're saying no, I'm not going to accept this, and I don't have to, and I'm going to show you. I'm going to go do blah blah blah.
that's right. Even when them gatekeepers are standing in that gate, you better blow that gate down.
And you never know, like what is amazing about the time we live in now, and you know, there's a blessing and there's a benefit in every situation.
Hmm.
Believe it, even if hard, even like COVID. COVID has opened up the door for so many. It has shown people another way, and it made people less fearful to go for it because it was like, well, this is not working. Like they really saw it, and people got a taste of freedom
Yes,
working from home. And now people, companies are have a ability to threaten people to come back to work and cancel people that they threaten don't come back.
they don't. They find another
So
opportunity that allows them to stay
exactly,
where they are, and there are plenty of them out there.
exactly. So now is the best time of all if you ever had anything you want to go for. And like like we talking about, even bringing it back to just keeping it to HIM. HIM is global. We talk about
Whew,
opportunities in the Middle East a couple of weeks ago.
that's right.
I mean, it is there is no limit other than the limit you put on yourself.
That's right.
And speaking of reach, like for this last Sunday, there is a nurse who was in South Korea, who is American, who is a teacher in South Korea, but but is ready to stop teaching in Korea, but doesn't want to come back to work in the United States as a nurse, even though he's licensed in California.
Wow.
He wants to take my coding course, and he's already in South Korea.
Come on, God. What did I tell you? See, you come.
Exactly.
What did I tell you? What did I tell you? Here we go. It is
Right.
international. You have you have different, like we have with ICD-10, we have ICD-10 CM, and other countries have their little acronym on the end, but the process, the information, the ICD-10 part is international. And you can open up now. Wait a minute, let me put all y'all, if you don't know, up on game. We are already into ICD-11. We haven't adopted it in the United States, but there are several countries who already have. And if you go out to the, I want to say, uh, I want to say one of the cooperating parties, and I think it's the NCH something.
Healthcare, the Center for Healthcare Statistics.
If you go out there, you can actually see um, the finished product, the ICD-11. So you can go out there, and then I believe they have it, or someone has um, webinars to actually walk you through and show you what the differences are as it relates to ICD-11. So before the rush, the mad, oh my God, we got to learn it, we got to do. You can go out there on your own and learn and pick up what is coming down the pike with ICD-11 before we even adopt it, and prepare yourself if you are interested in that whole international coding world. Prepare yourself to be on top of that. And who is telling you you can't? Nobody is stopping you to do that. And it's for free. Why not? Get that information.
Exactly.
Get that information. Yes. Love it. Love it. Yeah. And so I guess I'll give my throw out my other question.
Um,
Yes, ma'am.
could you expand on that a little bit? Because I only work in an institute that's who I know,
Hmm.
as far as information. How will I find out more information about that institution?
So the AAPC is one of the national health information organizations that we have. There's also AHIMA, American Health Information Management Association. Both of them spread their arms and reach internationally, and both of them offer various coding, uh, CDI, auditing, specialty certifications. They all, both of them, but they're coming from two different platforms. AHIMA is the oldest organization. AAPC is the baby by far. And AHIMA started out with inpatient hospital. So everything inpatient hospital was AHIMA. You couldn't get a job unless you knew something about AHIMA in health information. You had to either know somebody, be somebody, quote somebody, because those gatekeepers were real tight and strong back in the day. And so their primary focus was on hospital inpatient. They have since evolved. AAPC, however, has remained the leader in the professional side. So your physician profi coding, your outpatient coding, they are the ones that, and I like it to say AAPC is all about CPC and correct. Even though they do have an inpatient certification, they started out on the professional side and the outpatient side, whereas AHIMA started out on the inpatient side. So they're kind of merged, as the years progress, but they still have their original footprints where they are. And so that's why a lot of their certifications are recognized by hospitals. So hospitals looking for AHIMA credentials, preferably. They'll take AAPC, but usually their preferences are AHIMA. Same with physician offices, physician organizations, professional organizations on that side, or outpatient. They're primarily looking for AAPC. Let me get the.
I'm a little surprised that you just did the when you were mentioning where else you could be exposed and that there is an ICD code. That's kind of a surprise attention of where else can I get that information in closer.
It's 11. It's not 12. It's 11. It's ICD 11. And so, correct. So we were ICD 9 for years and years and years. So I'm surprised that we're actually moving as quickly as we are, because for years we were ICD 9. But because the way these diseases are being developed, the way conditions are and symptoms are forming, and the specialties that they're seeing evolved, some of the procedures actually that are coinciding with that. One thing, ICD-9, the way it was structured, we were running out of space. There wasn't enough room to apply codes to the new things that they were developing and discovering. So they formed ICD-10. Well, not that we're running out of space with ICD-10, but the way they are now structuring it more or less for the electronic medical record and a database kind of platform where, they want even more levels of specificity allowed for ICD-11 development. You can get more if you ever want to follow either the history or anything related to ICD, whatever number. You can go out to the World Health Organization's website, and they'll lay it all out for you. And then they have a whole coding tool, where again you can go out there and take a diagnosis and then code it through ICD-11 and see what comes up. Now it may be similar to ICD-10. It may vary, but again, they're showing you and preparing you for what is going to happen with ICD-11 as it's being adopted across the countries. Now, keep in mind, the United States has a clinical modification, or the CM. That's where the CM comes from on your ICD-10, and that is just for the United States. other countries have their own acronym at the end, to tell you, this is for this country, this is for that country. But the base is always the ICD-11, and that is where you can find the information on the World Health Organization, or WHO, on their website.
Thank you.
You're welcome. Mr. Jesse, did you want to jump in on that?
I wanted to ask you this question. Do you have any? I have two coding companies from Australia that follow me on Instagram,
Mm-hmm.
and what is so interesting is like they'll post, like you know how like people here will just post like random posts for like different events,
Mm-hmm.
and when they do it for the IT10 AU,
Mm-hmm.
the codes are very like the code category is the same,
Mm-hmm.
but the extensions are a little different.
That's really the only thing is because the foundation is the same, because it's the ICD, whatever the number it is that we're currently in. So yeah. Yep.
So it's only a little tweak you would need if you ever had to adjust the work, for another country.
Yep.
And like you said, if you have the the coding down, it's just a little tweak.
Yep. That's it. Because remember, you got to think about, we here in the US and other countries are either have been doing it, probably not as long as we have in the US, but um, have been doing it and are beginning to do it. We use ICD-10 for reimbursement purposes, where really it wasn't designed for reimbursement purposes. It was designed for statistical purposes. It was designed to collect data and information. So like when you hear about the number of people who may have heart disease, or the number of people who may have strokes, that information is based on the diagnosis coding that we do in charts and records. And so there's all that data. While yes, it's used for reimbursement purposes, it's used for statistical analysis as well. Not only, I remember, because it used to drive me crazy, because I'm like, well, wait a minute, let's get specific. And they were like, man, we don't do this here. When I had to do a practicum at the Bureau of Vital Statistics when I was starting out at coding, and so they code death certificates, and they actually assign a diagnosis code to those death certificates. Where I was being taught, you got to be specific, and I'm like, well, wait, and they were like, ma'am, if you don't put this category code on here and keep moving, I'm like, okay. But so it's a little different, in the way in which things are being coded, because they're not concerned about reimbursement. They're not concerned about that. Again, they're focusing on getting the data and getting that information out into the appropriate databases. So if you think about it, data is worldwide. Look how we track COVID. It's worldwide. COVID had to be assigned to these cases when people were coming into hospitals, or coming to see physicians or what have you. That information is tracked, i.e., the diagnosis code, regardless of what country you're in, and that's how you track those things. So it's bigger than just reimbursement. I know reimbursement is important, and it's important that you know what to do in order to be reimbursed appropriately, but also keep in mind, that's why we have like our ethical guidelines that we follow, because you can't just be out here slapping codes on things just to follow that money. No, that's not how we operate. That's not how we roll. So you have to be mindful of that as well, and know that it's bigger than just the money. Bigger than money, just the money. I felt like I was on a soapbox. I'm sorry. So Asha, did that answer your question? Alrighty.
Yes, totally, very thoroughly.
Okay. You're welcome. You're welcome. All right. So how was your week, Mr. Jesse?
It was like overall it was pretty good. Like I have to do, I don't know, I have to probably talk offline, because like what I really realized like this week, I'm stuck in terms of like moving. Because I told you like I want to do I wanted to formulate a PEI program,
Yes.
but I'm unsure about how to do it, because like I feel like I have, I work with nurses now. And the way that I do my ICM and other courses, I can't use the
Right.
it can't be delivered like that because it's too much that you have to know and you need to know it. Like, and I'm kind of like stuck as to how to structure it because what I really want to do is what I'm sure I'm going to do is just a matter of like just doing it. I realize that's what the issue is. What I have decided to do is I decided to do my CDI course like the nursing program.
Okay.
And like nursing programs don't play. Like you have a, you have content you have to learn. You have a minimum score you have to obtain, and after 2 attempts you're done. Because what I'm really realizing is because I know I know what the program can do. I know how it can impact you. But if you're not going to take it seriously, then you're not going to waste my time. And I want people to be serious. And I'm also going to like either like maybe double or triple the price because I'm not playing with it. Because CDI is real. Like you can really do a lot. You can make good six figures with CDI if you know your stuff.
That's true. That is true. Yeah, you do that. And yeah, we will talk. So are
Okay.
you or so is it are you looking as kind of people who are already exposed and certified or brand new green? I heard about this and I want to come in and do this. Or
Um, it was like my initial thing is for uh for nurses who have like a true care background, but they don't know jack about the person.
okay.
Because like we talked about before, nobody is doing like CDI. You either have to learn coding, or you have to learn the clinical indicators. Like nobody comes right.
Correct.
You have to be taught, something. So, but what I have seen and what I know is I've seen that, and I know firsthand that people get these jobs without even really having a background. But it, go ahead.
Mm-mm, go ahead.
But if you're going, but my thinking is, if you're going to, and they end up not doing well long term, even with short term, because they don't know. And if you're going to get into that situation, why not go into that situation educated? Why not go into a take, 3 month course, and then when you get an opportunity, you'll be set up for success to be able to be successful.
Yes. Now let me put this in your spirit because you're sitting in a space on both sides. You have the clinical nursing information, you know about the clinical protocols, you know all of that. And then you also have, actually, look, you only got two legs, but you in three spaces. But you also have, we'll use some arms then. And you also have the coding certification and the coding piece. But the beauty is you're also involved, heavily involved in the CDI space. So you bring a totally different level of information to whomever your student is. So even if you bring, so I don't want you to necessarily, I know nursing folks are your love, but I don't want you to necessarily think that your program should necessarily be tailored and focused to them because you have people who may be interested in CDI, who may be coding certified, but don't know that clinical piece that you provide and you can teach. So you may want to consider.
Okay, all right,
You see
okay.
what? So you may want to consider how because and I tell people all the time, like even in my class, if I have brand new people who are green, and then because I start at I don't know where you came from, I don't know what you do, but we're gonna start with medical terminology. You're gonna, if you don't know anything, you're gonna know how to have a conversation about what you're seeing in these charts. You're gonna be able to enunciate. You're gonna be able to talk the language. This is a whole different language over here. This is like going to a whole different country. You're gonna be able to talk to the natives, and I need you to be able to talk to the natives. So whether you've been in and it's amazing because I have people who've been in around facilities and still don't know. Well, I don't know what. No, we're gonna set that foundation. So for you, you can set that foundation. So while you may have some people who have the coding and they may glaze over because that's what the nurses need, you're going to have the same effect when you're doing the clinical indicators and the nursing stuff. The nurses will glaze over that piece, but then that's what the coder needs. And then you get them to the point where I got everybody where they need to be. We on an equal playing field, and then you throw that CDI on them. So you wherever they come from, you pull them together, you get them on that foundation, and then that's when so then everybody eyes wide open, paying attention and focus, because at that point you are applying an additional layer to whatever it is that they're bringing to the table that they need. So just sit that in your spirit, and once we get our powwow, we can walk through how that's supposed to look. But put that in your spirit, and that's how you start. Now the other thing is, and I was bad because I was like, I was bad, and that's part of what I need to do. I'm gonna need to stop relying on other folks and their materials, and write my own.
Oh, I always do.
I have my own. I'm talking about putting my whole written man. You're gonna get a book that I done put together that I wrote for my class. And so even though, we have most of my things are electronic, you can go out here, you can take your test electronic, you can do all of those things. I still, because I believe in practice, and more practice. And you practice by doing, and you have to do by having the scenarios and all of those things. And so I want you to have that. So part of the, when we were in person, like everybody would walk away with a huge binder. And in that binder, we filling up all the pages and all of that. And so I was like, well, now I need to just put that whole binder in a book. And that's what you'll get as part of the class. So I'm not necessarily relying on someone else's. My coding program has a book of its own that's just geared and designed for that. So yeah. So you may want to consider that and think about that, especially since we talked about some CDI certification preparation material that wasn't on point, and we can put together our own. I'm just saying.
You know what else I thought about? And I've also realized that, there's not much. Like, it's hard to find online coding questions.
It's hard. You have to develop your own and design them yourself.
Right. But I'm saying for that, when I thought about it, like, that right there is an opportunity.
Mm-hmm.
Because most questions are coming in certification guides.
Mm-hmm.
So they're geared towards a certain outcome rather than somebody who just wants to practice.
Mm-hmm.
And they don't focus, because I don't like how some companies do their questions, because like one company in particular, I won't say.
Here's some tea.
Their questions are they start off very simple. It's like, what is, cerebral infarction due to carotid artery due to, an embolism.
Mm-hmm.
Then you go into like a whole post-operative scenario. Like there's no in between.
Mm-hmm.
It's either the individual question or it's a case study.
Mm-hmm.
And it's like, wait a minute, you haven't even asked a combo question.
Right.
Like, and it's like, and people are, and I've noticed even when I was tutoring at the school, that's where people got stuck, because everybody can find the one line.
Correct. Yep.
But it's hard to get people to think about how to break down a scenario.
Yep.
That is what people get tripped up on, because what people don't understand about these exams, what I tell people all the time, these exams assume that you already know coding.
Mm-hmm.
So it's not even
it's not a coding test. It's not a coding exam.
Exactly.
Not at all. It's an application of the knowledge that you bring to the table. And as we have said a gazillion times, and the guidelines. And so even on the CPT side, we're making sure that you understand how to read an op report, how to read a lab report, how to read, anesthesia information, how to read radiology. You those are the things that you need to understand how to read, so you are able to code those things. And just breaking that information down is helpful, because oftentimes you don't see that. You're just given, a piece of it. Yep.
And what kind of feature a provider uses to close a wound is insignificant. You didn't know what type of wound it is. Is it a simple closure? Is it a layer closure? Is it complex? That's all you need to know. If you see the tension sutures, okay, that well, you know what that means. So, and it's just, and I'm like, there's a whole opportunity at the whole range for just questions because people can't find it.
And I would get it all the time. Could you give us some questions? I'm like, for free? Like, for free?
Excuse me, I have a question to ask. I'm gonna have to leave shortly because I have a phone starting at 9.
Okay.
But this is my question for both you, Clarice and Jesse. In the programs that you offer, do you offer like for people that work and they have tuition reimbursement? Have you either one of you have a program where tuition reimbursement would be used in that program, or have you thought about like partnering with some schools that you like straight align where you could offer your classes and that could be covered through tuition reimbursement?
So I actually partnered with a organization, healthcare organization here. Actually, I've done it twice in two different healthcare organizations here. I'm in Cincinnati. And what we do was we set up, they had so many people that they were trying to grow their own coders in their program. And so they would send them to me, and I exclusively worked with their staff. And they came in, everything was paid for by the organization. So my contract per se was with the organization, and then they just sent the students at the times that I was offering the classes for them. And we normally did it at a space that was in their location, so it made it easier for them. They're already there; they can just come on over in a conference area or what have you, in that location, and do it there. I haven't done one online yet, but normally I do. My classes now are primarily online, but there are live sessions included in those, so they can get like their async material online where they can go through and review the material and have that with me, going through and pointing out what is necessary and what what they need to know. But then we also come together and meet and discuss. And because for me, I don't feel like I'm doing a good job unless I know that you're understanding what is going on. And I need to see the light bulb flash across your face. So I say, okay, I know you got it. And so, I try to encourage, and that is really that extra piece is for me so that I can talk to you, I can see you, and I can get where you are going or understand whether or not you are retaining and obtaining the information that I'm trying to convey. So yes, I have done some tuition reimbursement situations that way. And then my contract again is with the organization. And then they also want to know, the progress of the student. And so I would have to, in one of those cases, I had to kind of let them know this is where they are. They're coming, they're not coming, this is what their test scores look like, so they understand that it is based on their performance in the class and that they need to be here and all of those things. But and then I prepare them for certification. So again, whether they meet the certification or sit for the certification piece is a contract again between the employee and the employer. But my contract was with the employer in making sure they got the information they needed to sit for that exam.
Well, for me, I haven't done it because my program is not long enough, and I don't teach because to get reimbursement, you have to teach all of the elements of the program, and that's why I have a very niche market with nurses.
Mhm.
Nurses don't need to be taught medical terminology, pathophysiology, and A&P. I go right into the coding and to reimbursement methodology. So my program is not long enough for that, but I have had nurses who their jobs have reimbursed them because I just give them an invoice, and I am an approved provider, so I can give a training certificate, and it is an approved certificate, so they get reimbursement on that, and if they take it up with their employer.
Okay, thank you.
Mhm. You're welcome. Cool. Yeah, that was fun. You have all these people coming through the day. It'd be like, oh my God. But I love it. I love it, especially people who are brand new. And we've been talking about even doing some things at the high school level and just putting it out there and getting them to see at that stage that this is a viable profession. This is something that they can get into. This is something that even because I'm truly an advocate for education. I believe education opens all kinds of doors and gets us out of all kinds of situations and help elevate us out of some of these socioeconomic situations that we may be in. I'm a firm believer in education. But even if, hey, I want to go to school to be XYZ, get that coding certification as a stepping stone to make you some money along the way, where you don't necessarily have to um, take out loans or whatever for your form, quote unquote, formal education. You have a bankable skill to help get you to the next level. And this skill will last you forever. As long as you can read and see, you can code.
I just think that, like I said earlier, like this is the best time to get into it. But I just think that you know there is just a shift in society. Period. It is almost like there is a pushing out of the old, and they are resisting it like hell.
Mm-hmm.
They are fighting, moving forward, but we have to move forward because the old system is not sustainable.
Yep.
And even how education is um, done in this country is outdated.
It is.
Like we have all of these people, we have all of these needs. Like matter of fact, I read the article that you were talking about with health information, human information. There's a piece in there where they talk about how many petabytes of data were generated just last year.
Mm-hmm.
I mean, a petabyte is, I can't even enough comprehend what that is. But trust and believe, all of the information is going to go through somebody's data analysis, every bit of it. So they're going to need people to do that. And if these coded programs, if the HEMA, if AAPC were really, really smart, they would devise programs where, okay, like a place like the HEMA, if you go to a HEMA program, you should be able to go to that same school and take like maybe two or three classes, two or three coded classes like SQL, like Python, Excel, and get a certificate that will make you eligible for the CHDA exam for certification. And then who's better to have somebody who's knowledgeable of the code and knowledgeable of databases to work to run a database,
Mm-hmm.
especially in healthcare.
Mm-hmm.
Like, and look at how many people you can funnel into that straight from high school,
Mm-hmm.
and then get people who are already in the industry to make a quick little pivot. You take some courses, it'll take you a couple months, and you're into a whole new arena.
That's right. That's
But
true.
it's just, but you have to have the vision. And these people, they're just, the days of gatekeeping are over, but they just refuse to lay time down.
And I think because we talked about this a couple of weeks ago, where certain programs are incorporating health information into a STEM program and looking at that. And so, to your point, if they had their way, they would still be people in the facilities printing off copies of medical records and handing it to
Yeah.
people. So it's like technology is evolving, everything is evolving, and part of what being a lifelong learner entails not only understanding the rules, the regulations, the guidelines, and all of that, but keeping up with what is happening from a technology perspective. It's our duty to make sure that we are on top of that as well. Yep. Oh, we had another person on the stage. I was going to call him, but he disappeared. All right, all right. Ah, well, this was good. This was good.
Yeah.
This was good. Even though we didn't have anything formal, I feel like I done preached the whole sermon now.
But we didn't have anything together, but we still gave out a lot of information.
We did. We
A
did.
lot of that. So the name of the game is you have to know that you have options,
Yeah.
especially in the world of HIM. You always have options, and you cannot let an employer dim your light.
Mm.
Even if you're applying for a job, you can't. I mean, I've had to. I mean, because some of these recruiters, man, they are like.
And I always tell my students, I say, go for the gusto. Yeah, you may not even have all of that, but that's their wish list. They're gonna take what if you have whatever it is that you bring into the table. If it matches a need, they're gonna take you. So even though they may say, "Oh, this is required," not necessarily. Not necessarily. It's usually preferred. They may say required, but in this day and age, it's probably on the preference list and not necessarily the required list. And at the end of the day, all they can say is no. No, it's not gonna kill anybody. Keep going, keep hitting them no's until you get to that yes, and it'll be so much sweeter.
Because a lot of times, what people have to understand, especially when it comes to a no, just like just like we talked about earlier. Sometimes they'll say no because you intimidate them.
Mm.
Like I've taken pre-screening tests, and anytime, and it hasn't happened like every time I've gotten 100 on the be accepted,
Mm-hmm.
and never got the job. Never got the job. It's always something extra. The first time I had them, I was working as an auditor, and it was a coder job.
Mm-hmm.
And I took the test, so when I meet with the lady to go over the test, she was actually like, she was stunned that I got 100. Then she was like, well, when was the last time you were in production and you had an IRR? I said, well, it's been a couple months. I said, I've moved up to audit. I don't do that.
Right.
Oh, well, for this employer, you have to have had an IRR within the last 30 days. So if that was the case, why was it not in your head? Why are you saying it now?
Right.
And it's just like they come up with stuff. And it's like that's how you know you really can't you can't pay them any mind. You really can't.
Not at all.
You can because these people are complete idiots.
Not at all. One of the things I tell my daughter, I tell her all the time, you know, sometimes you have to be willing to do well, because she's in school and she's a student. She's young and she sees, the world of social media. I'll be like, girl, sometimes it's an illusion. Just be mindful of that. Some things are an illusion. They like to show you some things, and some things may not be. So keep that in mind. But I tell her you be willing to do the things today that others won't do, to have the things that others won't have. And so, yeah, you may have to sit there and you may have to study and you may have to take that time and do whatever it is, the research and all of those things. But trust and believe that time that you put in will pay off in the end, definitely. And so be intentional and remember discipline and consistency is the key. Even what I do here on this, consistently showing up. People expect me to be here at 9 a.m. Even if it's just Mr. Jesse. Folks expect me to be at least on the other side. And normally I'm in here about 8:30, but people expect me to be here, set up, ready to go at 9 o'clock. Even if it's just to see who in the room or what we're talking about or whatever, there is an expectation. And I've accepted that challenge. I know I'm expected to be here. I got people waiting on me. I need to do what I need to do. And so just be disciplined about your things, whatever it is, in coding, professional, personal, what have you. Set up a level of discipline and then be consistent about it. That will take you so far in life. So far.
It will.
So far. Cool, cool, cool. Well, I believe that the tea has been spilled. And Mr. Jesse, do you have any closing thoughts?
No, I just want to wish everybody a happy, healthy, productive week. And once again, happy birthday to you.
Thank you. Thank you.
And once again, I'm just appreciative for that you created the space because this information, we don't know who we touch, we don't know who we impact, but if we're not here, then we can't make an impact at all. So
Exactly.
being here makes a difference, and I'm glad that you created this space, and I'm glad
appreciate you. I appreciate you. I always say God put us together for a reason. Lord, he was talking my mother, like so. Those who don't, I'm a caregiver for my mom, and when we first started talking, she was like, "Who is that man? He has such a wonderful voice." Like she wasn't in the room, but she could hear you because I have you on the speaker. And she was like, "Who is that man? He has such a wonderful voice. I could listen to him for hours." I was like, "Bing, bing, bing! That's the one I need right there." Folks can listen to him for hours. So you can also thank my mom for that because she was like, "I don't even know who he is, but and I don't even know what he's talking about, but I could just listen to him for and that's
Thanks, Mom.
right, and that's how we all got together. Like this is what's up. So again, thank you all for joining us for the Saturday morning tea. Prayerfully, the tea was spilled. You got some information. You got something to encourage you. Don't forget, this week is Health Information Professional Week. So celebrate your wins, your successes. Celebrate what you've accomplished, even if it's something from last year to this year, or 5 years from now to this year, or what yesterday to today. Celebrate, celebrate those wins in our profession. And let folks know what it is that you do. You never know. Somebody may be struggling and trying to determine, well, what is it that I want to do in my life, and have no idea that we even exist. Let them know this is what I do. This is what you could do. Hey, this may be something for you. You don't necessarily have to do XYZ. Come check it out. Check it out for yourself. It may be something for you. So again, I hope this information was valuable for you and helpful for you. And if so, please share the message with others. Like the video, subscribe to the channel, share the video, let folks know. Hey, they talking about something over here. You may need to know and hear what it is that they're talking about. Don't forget to check out the registered coding nurse channel on YouTube. Check out Mr. Jesse and all that he does. Wait, you have something today? See, sorry, you be killing me. I'm about to be in my feelings right now. Don't you got something going on today? I told you. I told you.
Okay. Well, at 3 p.m., I have a live discussion with another nurse coder. Her name is Raquel Wilson.
I love her. Tell her, hey.
And we're going to be talking about the skills nurses need to become a medical coder. And I always, because I listen, Clarice and I talk about nurses and given the age I am, I always talk about how nurses have to work on their ego.
Yay!
Always, because that's true.
It's true.
I see it.
It's true.
I know in my course, I know that they have to. It takes them a while because they have their. It takes them a couple weeks to have their head in it.
Mm-hmm.
Before they really realize, okay, well, this is not what I thought it was going to be, and I really have to I have to know this stuff. It takes them a minute because they don't see it from the beginning. It's a joke. And then you start asking them what guideline is this, and they can't tell you. What's this called relationship? They can't tell you. They ask you what you ask them what's this guideline, and they say, "Did you see something?" When the doctor could rule out heart attack and they have chest pain, and you ask them, "What can you code?" They try to code both. No, man.
That's right, and they get shook. They get shook because that ain't where that's their comfort. That's not their you shaking about their comfort level, and that's what. So, sir, don't make me fly to Pennsylvania, sir.
Okay.
Sir, I done told you a gazillion times. Now you see, she's not on here. She said she had her room. She came right on in here, talked about whatever it is she's doing next week. I don't even know her, but she came right on in here and plugged whatever it was that she was plugging. And I you know me. I'm okay. We gonna let you get that off. But you are my co-host, sir. And if there is something that you have that you are doing, this is your platform. It's not just mine. It's ours. It's ours. It's us, y'all. It's us. So please let us know what it is that you're doing so we can support you. We need the support. Okay. See what I have to deal with, y'all? See what I have to deal with? No, that's my buddy. And it's for me to encourage him to come on out there, chill, and tell folks what's happening, what's going on. You never know. Somebody needs, and I say that all the time, you never know. Somebody needs to hear the message that you have. So all you got to do is tell them whether they can come or not, whatever. Just put it out there. Put it in the atmosphere. Put it in the atmosphere. So, yes, you do that here. Don't forget, for those of you in Clubhouse, you can click the little greenhouse at the top of the page. That's our little club. And join in and get connected with us. You got a wealth of knowledge and information and folks here. This is a networking opportunity in Clubhouse. At least I think it is. So you come when you're in the Clubhouse, follow the folks that's in here. Find out what's going on. You never know who can help you do what. Trust and believe. That's how me and Mr. Jesse got acquainted. We clicked up here on Clubhouse and then looked and said, well, wait a minute, hold up. I see something here. And of course, my mama saying his voice was nice and she could listen to him all day. But yeah, network with each other. And then you click the little green club and little house at the top of the page, and that'll let you know when we have our sessions. Now, typically we are here. Well, generally we're here every Saturday morning at 9 a.m. Eastern Standard Time. Every now and again, I may pop up and just be like, hey, I'm just, whatever. Normally I don't do that, but you never know. And if I see somebody or if I see something that's going on that somebody is talking something that we may need to know, then let me let y'all know, hey, this is somebody, if you out here and you on Clubhouse, this is somebody is talking and it's something that may be beneficial. So I try to spread that wealth as well. So, make sure we all stay connected. So again, this has been a great session. Tea has been spilled, even though I don't even have my tea. I feel bad because I didn't even. I've been so on 10 because it's my birthday. I've been up since 6 o'clock. Hopefully I don't crash and burn, and my husband be looking at me some kind of way, like, really, this what we doing? I guess I'll have to take a nap at some point during the day. But I hope you have a wonderful Easter holiday. If you celebrate Easter, have a wonderful Easter holiday. Show some love. I know we're still in a pandemic, but things are, we got some variances rising here and doing that, but just stay safe, everybody. I know we want to get with each other and see each other and love on each other and hug on each other, but just remember, we got to be safe and take care of ourselves. And so enjoy your time with your family. Thank you all for joining, and we'll definitely see you next week. We'll definitely look for some things that's more structured in our normal program, but this is a separate special celebration since we celebrating me and HIP week. So again, as always, this is a great session. Thank you so much for joining. Remember, be safe, be kind, and don't wish for it, work for it. Until next week, take care. Talk to you soon.
Bye-bye.
Bye-bye.